Hello, I'm Brooke McClung, and today I'm going to be talking about some of the upper extremity muscles. Starting with the Latissimus Dorsi, the origin is going to be on the T7 through L5 spinous processes, as well as the superior sacrum and the iliac crest, and it will insert on the inferior angle of the scapula, as well as the medial lip of the inferior bicipital sulcus of the humerus, which is a mouthful. And at the scapula, it is going to depress, retract, and downwardly rotate it. And at the shoulder, it is going to extend, ABduct, as well as internally rotate it. And then moving on to the supraspinatus, it will have its origin on the, you guessed it, the supraspinatus fossa, and it will insert on the just superior to the greater tubercle of the humerus. And it will perform abduction as well as internal rotation at the shoulder. Teres Minor will have its origin on the axillary border of the scapula and will insert a little bit posterior to the greater tubercle, and it will perform adduction as well as extension and external rotation at the shoulder. The Coracobrachialis will have its origin at the coracoid process of the scapula and insert central and medial on the diaphysis of the humerus, and it will perform flexion and adduction at the shoulder. The brachialis will have its origin on the anterior portion of the humerus, about midshaft, and will insert at the coronoid process as well as the ulnar tuberosity of the ulna. And moving on to the triceps brachii lateral head, it will have its origin on the posterior shaft just superior to the radial sulcus and will insert on the olecranon process of the ulna, and it will perform extension at the elbow. And if I didn't mention this before, I thought I already did, at the brachialis the flexion will be performing, its action is flexion, and it will be performing at the elbow. And then triceps, it will be extension, brachialis, flexion. Anconeus, also extension at the elbow, will have its origin at the lateral epicondyle of the humerus, and it will insert a little bit posterior to the olecranon process and along the posterior border for a little bit. And after the Anconeus, we will discuss the Flexor Digitorum Profundus. I went through this whole video and I made a huge mistake midway calling a metacarpal a metatarsal, so if you notice a little bit of a skip, that's because I have edited the video. So the Flexor Digitorum Profundus will have its origin on the interosseous membrane as well as the border of the ulna to the posterior portion of it, and it will have its insertion on the distal phalanges of the digits 2 through 5, and it will perform flexion of the digits as well as the carpus. The Pronator Teres will have its origin on the common flexor tendon as well as the coronoid process, and will insert on the oblique line of the radius, and it will perform pronation of the antebrachium as well as flexion of the elbow. The Extensor Carpi Radialis Brevis will have its origin on the common extensor tendon of the humerus and insert on the base of the third metacarpal, and it will perform extension as well as abduction. The ABductor Palmaris Brevis will have its origin on the flexor retinaculum as well as the scaphoid and the trapezium, and insert on the distal portion of the phalanx of the pollicis, and will perform abduction of the pollicis as well as some flexion and opposition. The Opponens Digiti Minimi will also have origin on the flexor retinaculum, but also the hook of the hamate, and will insert on the lateral portion of the fifth metatarsal, and it will perform opposition of the pinky, that fifth digit. And then moving on to the Palmaris Brevis, it will have its origin on the flexor retinaculum as well as the palmar aponeurosis, and insert on the medial portion of the hand. And its job is just to tense the skin right in this portion right here. And now moving on to our last little group of muscles, the Dorsal Interossi. They will have their origins on adjacent metacarpals, making sure I'm saying metacarpals, and then they will have their insertion on the base of the proximal phalanx as well as the extensor expansions of digits 2 through 4. And the job for these guys is to perform abduction of the fingers of the digits. And that is all that I went through. I think I covered all my bases with these guys. I do think that I made a little bit of a mistake earlier in calling this the supraspinatus fossa. It's called the supraspinous fossa. So thank you for listening. Bye.